this week I've been thinking about what is the value of a patient's life. Specifically for me, what is the value of my daughter's life? What is the value of your child's life? You know, I have been a professional musician most of my life. That's why I bring my guitar, because it's what I'm good at. I had the blessing of working my way up to the middle. I had a couple of top 10 hits, a video on VH1, toured the world, and had a really successful career. And then I got married and had children. I have two daughters, Wes, who's 8, and Rose, who is 7. And Rose was born very different. She would choke on her food, couldn't lift her head. I would have to give her enemas. That sucks. And she was severely developmental delayed. When she would try to walk, she would fall flat on her face because her brain couldn't tell her to put her arms in front of her, and she just bust her nose. But when she lost the few words that she had around 18 months, we knew that it was a more serious problem than what the current failed diagnostic odyssey of our healthcare system is for these diseases. So we do some research and we figure out we need to do a whole exome sequence or a whole genome sequence. So we did a whole exome, and I think it was like 10 grand at the time. Wow, the prices have come down so much, you know. And I took it to the neurologist, and I'll never forget walking in the office with both my daughters, and he goes, "Casey, your daughter has a rare genetic disease called HNRNPH2. There is no cure. There's nothing we can do. Good luck." And that felt like a death sentence, you know. Was Rose going to die? Am I going to be changing diapers for the rest of my life? That sort of set me on a journey because I had reached the dead end of my healthcare system in my country. And I didn't realize hundreds of millions of other families had too. And so, you know, I actually fell asleep in biology class in high school. So I was sort of starting at negative 100. I was like, what is a rare disease, you know? And so I Google parent cures child of rare disease. Of course, that's what all the intelligent people do. And all of these articles come up from a woman named Julia Vitarello. And being, not being a professional stalker, but going, okay, I think I need to find this person. And luckily, I was sort of a cool musician, and so maybe that's why she responded to me. But we began a friendship years ago. And she told me her story. She told me how she raised the money. She told me how she put the science team together, the lengths that she went, because she felt like the value of Mila's life was worth it. And I met Tim, and I met their team, and I actually work with them on some other projects now. But she mentored me, and that set me on this journey, and I met and talked with hundreds of academics and researchers and foundations and biotech companies and CEOs, and I learned some very disturbing things and some very hopeful things. I learned that, like we saw today, we have technology to cure many of these diseases, or at least help them. But what we don't have are the pipelines, the business models, the systems, the data that we need to be able to do this efficiently and sustainably. And so I wanted to set out to change that. You know, I'm watching all these family foundations pop up all over the world because they feel like no one else is going to develop a drug for them. And so teachers and musicians and I know this construction worker that's like one of my favorite drug developers that I've ever met. And what they're seeing is, you know, our diseases, many of our diseases, are just not commercializable with the current regulatory path, the current business model that we use. And so what happens is that as I sort of started doing my research, is that these these drugs, or you're going with an academic institution, and then a biotech company wants to take it commercial, but the investors are like, man, I don't know, and we have to make choices. We have to make business decisions. And so these drugs get stuck. They get stuck in both academia and industry. And I've literally seen children die because of this. And so, that to me tells me that we got to change some stuff. So I started a foundation, started raising money. I built a science team. We did the minimal amount of disease modeling on my daughter's disease, and thought an antisense, obviously, as a good route, me knowing Julia and Tim. And so I tried to recruit an academic institution to do that. And the scientists were awesome, and I couldn't wait to work with them. And they said, here's this one guy. He works at the tech transfer office. I want you to talk to him. There goes 6 months. With the end of it being, sorry, I don't think we can make this work. And it wasn't a money issue. I mean, obviously, we weren't a big foundation. So I was really frustrated. I sat with my CSO, who's this brilliant drug developer and has a huge heart for these kiddos, and said, man, we dreamed. We imagined a lab that could do preclinical drug development for these kiddos that wouldn't own any of that data. We imagined a lab that could be thinking more vertically integrated all the way to an IND. That we imagined a lab that was utilizing robotics, AI, data, that was really thinking to the future. We imagined that maybe we could look at genetic treatments one day, like molecular surgeries, something you would go to the hospital for. Imagine that maybe the next Rose that got diagnosed could go through a computational system with a vertically integrated lab and have a drug within months, maybe weeks, maybe days. And so with that, within months, I found some funding to start this company, this lab, Everloom, and we are now working with multiple family foundations doing preclinical drug development. And Rose's ASO is about a week away from our first data around a healthy proof of concept in cell lines. I'm pretty excited about that. But I see Rose as what is a child's life worth? And really, Rose is stuck under this red tape, these arduous process, these regulatory guidelines that were made for large drugs, not for diseases like hers. And for parents like me, we see this as a human rights issue, at this point. We see this as there are technologies available. Why can our children not access them? This feels like a third world country problem. And what I have found is that my community of drug developers and some regulators and some people in the government and some people at institutions, academia, and industry, many of you here, have become the new rare disease healthcare system. It's not very sustainable, but we're all working on it. And so I have an immense amount of hope. I have hope that the people in this room, that we can begin to make decisions that are different than what we've made in the past. Rose is really an amazing little girl. She, oftentimes during the day, she's incredibly confused. She screams a lot for unknown reasons. It's a neurodevelopmental disease. It's an X-linked disease. Expresses all over the body, but we're targeting the brain. And she feels alone a lot. It's hard for her to connect. And so, but I get this moment as I put her in the bath around 6:30, and then I put her on my bed and I grab my guitar, and I don't tour anymore, so she's my audience of one, and I sing to her, and I'll hand her a harmonica, and she'll sit there and so I can blow on it, and for a moment, we're in a band. She feels connected. I feel connected. And it makes me think about maybe that's where we need to start coming from. The fact that, because that's why I'm doing this. I'm her dad. I don't have a PhD. I don't have an MD. I don't have experience doing this, but damn, I'm going to learn it, and I'm going to surround myself with people like you. So if we approach these problems with our humanity, we are fathers, we're mothers, we're brothers, we're sisters, we're sons, we're daughters. Maybe coming from that place, we will make different decisions. And so my hope is that Rose is suffering, my family's suffering, Julia's suffering, Mila's suffering will not be in vain. And that we can use that as inspiration to make the changes we need to. You know, towards the end of, they made the ASO. It was amazing what the FDA did. It was amazing what the entire team of people did to get this sort of personalized treatment going, but it wasn't in time for Mila. So Julia called me and towards the end of Mila's life and said, Casey, would you come up here and meet Mila and talk to her about death? Well, I'm actually a death professional. Sounds very morbid, I know, but I lost my brother and father to suicide. I've lost a lot of people in my life, and I have learned how to grieve. I've learned how to talk about it. I've certainly learned how to do everything the wrong way. But Julia knew this about me, and I've been walked Julia through that fire. Sorry. This memory is burned in my brain. How do you talk to a child about death? Mila could not see. She couldn't move. She was trapped in her body. But she could hear. And so she laid on this bean bag. And as an artist, I didn't want to give her my version of heaven. I didn't need to put on thousands of years of theology to somehow make things better and sweep it under the rug. But as an artist, what I knew I could do is give her metaphors and make her excited about what was next so she wasn't afraid. So I would use metaphors, and I would just write these silly songs for her. And one of the songs was her younger brother, Aslan, since we're all talking about what's next. He was like, I think we come back as animals. And I think Mila's animal is a hummingbird. And so one of Mila's favorite birds was a hummingbird. And so I sat there and I said, Mila, can you imagine coming back as a hummingbird? And I think about Mila's life and how it's inspired us, inspired the rest of us, and how her life goes on, how she reminds us that time equals life. So Mila, this song goes out to you. Thank you for inspiring us. I sing this song to you again. This is Hummingbird. If I were a hummingbird, I'd fly right over this entire world. I'd drink from all the flowers so I'd keep flying back every hour. And I'd look down on all my friends, and I would fly by saying hi to them, and they'd see me as I am, a beautiful bird with the soul of their friend. And I'd fly to
some giraffes and some elephants and some cheetahs. And I'd go to India and I'd find a beautiful temple, meditate on love. If I were a hummingbird, I might sneak upon some people and surprise their world, and I'd show them that life don't end, it just changes into something beautiful, and it changes again. If I were a hummingbird, I would hover close enough to hear your every word, and I'd find ways to let you know that we will always be together, no matter where I go. Yeah, I will be your hummingbird wherever you go. Thank you.